Hi, everyone. Good evening. I am recording this on Thanksgiving evening, so I hope that you all enjoyed a nice long weekend. This lecture is a recorded lecture in lieu of class on Friday, October 14th. And I just wanted to go over a few things in regards to chapter 3 and suffixes, because I won't be there to teach you in person. So this will just be a short PowerPoint, and then I'll give you some further instructions. So I just want to go over some of the common diagnostic and procedural suffixes. The first one is osis. And an example of a word using osis would be cirrhosis, that some of you may have heard that term before. So osis means abnormal condition. So cirrhosis means an abnormal condition in the liver. This is a late stage of scarring or fibrosis of the liver that's caused by a number of liver diseases and conditions, including hepatitis and chronic alcoholism. Now, the literal meaning of cirrhosis is abnormal condition of yellow orange, as opposed to abnormal condition of the liver. And you might wonder was that derived? And it's from the Greek word kyros. And a French physician named this disorder of the liver because of the abnormal color of the scarred livers in alcoholics at autopsy. So as you can see in this diagram, a normal liver is kind of like a dark red, almost burgundy brown color. And the liver in a person with cirrhosis, you can see is kind of a yellowy orange color. Now, one of the scans that we used to do was a liver spleen scan using colloid to evaluate patients with the various stages of liver disease. And this was an example of a patient. Normally, what we would see is primarily liver and spleen. And we really shouldn't be seeing any of this uptake in the bone marrow. But this patient has end-stage cirrhosis, and that's why the liver, you can see, is kind of small. It's still picking up the colloid, as is a large portion of the spleen, but we are also seeing a lot of bone marrow. We don't do these scans too often anymore. The liver spleen scan for this condition's been replaced by ultrasound, CT, and even MR for some of the patients. So this is just for historical sake. But we do sometimes have patients that come to us with cirrhosis, and so you should be familiar with the term. Another common word using osis is scoliosis. And some of you may have heard of that term. Some of you may even have scoliosis. And it's defined as an abnormal condition of the spine. And so this is a lateral curvature of the spine, right? Normally the spine is nice and straight. And this comes from the Greek word scoliosis, meaning bending or curvature. And sometimes when we do our bone scans, if the patient has severe scoliosis, we can actually see evidence of that on the bone scan. Okay, the next common diagnostic suffix is megaly. So an example of this would be splenomegaly, if you can think about what that word might mean. So megaly means enlargement. So splenomegaly means enlargement of the spleen. Hepatomegaly would be enlargement of the liver. And you can apply this to a number of organs in the body. So a normal size spleen would look like this. And this is a diagram showing what a patient with splenomegaly might look like. And again, here's one of our liver spleen scans. This patient actually has hepatomegaly, so an enlarged liver, as well as a very large spleen. And normally we would put a marker on the image so that we'd know, we'd be able to actually do a measurement to confirm that the liver and spleen are enlarged. The next suffix is oma. This is a very common suffix. An example of a word with oma would be melanoma. You probably all heard about melanomas. So oma means tumor or mass. And just the word oma itself, or the suffix oma itself, doesn't really tell you whether or not the tumor or mass is benign or malignant. So you can have a melanoma, which is a tumor of the melanocytes, which are the pigmented melanin-containing cells of the skin. So melanoma is a malignant tumor. Myeloma is a malignant tumor of the bone marrow. And myoma, these are benign tumors that are usually composed of muscle tissue. So some of you may be familiar with the term fibroids. Fibroids are just these benign tumors. So fibroids are examples of myomas. So just a note that many malignant tumors will have the term carcinoma or sarcoma in their names, but some malignant tumors don't. So you can have a Ewing's tumor, sometimes also referred to as a Ewing sarcoma. You can have a hepatoma, multiple myeloma, a Hodgkin's lymphoma, but you can also have something called a Wilms tumor, which is highly malignant, and yet it doesn't have the term carcinoma or sarcoma in the name. And this is an example of a patient with an osteogenic sarcoma in the femur. Okay, the next suffix is pathy. Okay. So a term that you might be familiar with is retinopathy. Retinopathy. So pathy just means disease, right? Which you might have figured out if you think of the word pathology, right? Which is the study of disease. So retinopathy is the disease affecting the retina in the eye. Common terms that we often come across would be adenopathy, which is a disease of the glands or the glandular tissue or the lymph nodes, or more specifically, lymphadenopathy, which is a disease of the lymph nodes. So we do things like gallium scans and PET scans looking at, say, Hodgkin's lymphoma. And these patients may have evidence of lymphadenopathy, right? And you can see that there's a lot of uptake in the various lymph nodes. So this would be an example of lymphadenopathy. Another term you might be familiar with is psychopathy, which is a disease of the mind, right? Or the word psychopath, which is a person who has a disease of the mind. Another term that is becoming a little more common that you might run across is osteopathy. Okay, so, or osteopaths, you may have heard of them. So osteopathy is a disease of the bones, right? Osteo is bone. But more commonly, this term refers to a system of therapy that involves the manipulation of the skeletal system. And it's based on a theory that the body is capable of producing its own remedies against disease when its structure is normal and it has the proper nutrition and a favorable environment. So an osteopath is a licensed physician who practices medicine using both conventional methods and osteopathic manipulative medicine, which focuses on relieving pain and tension in the musculoskeletal system. So osteopathy is a disease of bone. Okay, another common suffix is rhea. Okay, so a term that uses rhea would be rhinorrhea. So rhino, remember, means the nose. So rhea means flow or discharge. Now, you probably are familiar with the term diarrhea. So if you ever forget what rhea means, think about diarrhea. So dia means through, right? And rhea means flow. So with diarrhea, right, your fluids run through and come out through the anus, right? Rhinorrhea is a discharge, in this case of CSF, through the nose, right? So rhino meaning nose. Otorrhea is a discharge of CSF through the nose and the ear. So auto is ear, rhino is nose, and rhea is flow or discharge. So sometimes we do CSF scans to look for leaks of CSF, and you can see here. So the darker areas are, this is the spinal cord and going up into the ventricles. And you can see these two little faint areas here. And what this is some of the CSF leaking out through the patient's nose. And because we put a radioactive tracer in to the spinal canal, it mixes with the CSF, and then we can trace where it goes. And in this case, there's evidence of it leaking out through the nose. The next term is urea, right? So a term using this would be albuminuria. That's a hard one to say late at night. So urea means abnormal condition in the urine. Okay, so albuminuria is the abnormal condition of protein or albumin in the urine. You can have glycosuria, which is an abnormal condition of sugar or glucose in the liver. You can have pyuria, which is an abnormal condition of pus. Pyo means pus in the urine. Or commonly we see patients that have hematuria, okay, which is the abnormal condition of blood in the urine. Okay. Now, just a note, you don't want to confuse hematuria with uremia. Okay, so hematuria means blood in the urine, whereas uremia means high levels of urea in the blood. Okay, so maybe put a star next to these two words to pay extra attention, because a lot of students get those two mixed up. Okay. Okay, another common suffix is ectomy, right? So you can have what's known as an endarterectomy. So endo meaning within, art or artery, right, within the artery, and ectomy, removal. So ectomy means removal, and an endarterectomy is the removal of the inner lining of an artery. And it's usually because there's plaque in the artery, so they'll go in and they'll remove the plaque and restore the flow through the vessel. A nephrectomy would be removal of a kidney. An appendectomy is removal of the appendix, and a tonsillectomy is a removal of the tonsils. Okay, so this is a very common term that you will come across. Centesis is another common suffix. So you can have something known as abdominocentesis. Some of you may have heard of this. So when a mother is over the age of 35 and is pregnant, I'm mixing it up with amniocentesis. Abdominocentesis is just when a patient has fluid in the abdomen, and you're going to do a surgical puncture to remove the fluid from the abdomen. So they usually just put a big syringe, a needle into the abdomen and pull out the fluid. And this is sometimes also known as paracentesis, para meaning beside. I was referring to earlier the amniocentesis, which is when you have a pregnant woman who is older, where they're worried about fetal abnormalities. So they'll do a surgical puncture of the uterus, and they'll remove some of the amniotic fluid for testing. You can also have thoracentesis, which is a surgical puncture to remove fluid from the chest. So sometimes people have a buildup of fluid in the chest cavity, and it may restrict their heart from pumping. It may make it harder for them to breathe. And so they'll puncture the chest wall and they'll remove some of the fluid. So this procedure used to actually be referred to as thoracocentesis. So if you remember thoraco meaning chest, and just over time they've shortened it to be thoracentesis. It kind of rolls off the tongue a little bit easier than saying thoracocentesis, but this is a correct term for the surgical puncture. So you can use either of them. Okay, plasty, right? So you may have heard of an arthroplasty, which is the fancy name for a joint replacement. So plasty means surgical repair of something. So in the case of arthroplasty, arthro meaning joint. So it's the surgical repair of a joint, which is usually by way of replacing the joint with an artificial prosthesis. So you can have a hip arthroplasty or a hip replacement here, where they've removed the head of the femur. They put in a implant. Or you can have a knee replacement. They do shoulders now as well. And this is just a scan. This is probably a combination bone scan, maybe even a bit of white cell scan. I'm not sure, don't have the history here, but you can see that this is photopenic in here, right? And that's where the hip implant has been placed. So arthroplasty. Rhinoplasty is the fancy name for a nose job, right? Surgical repair of the nose. Angioplasty is another common term you'll run across. This is the surgical repair of a narrowed coronary artery. And they do what's known as a balloon angioplasty, where they'll put a catheter in. So you can see there's plaque here. It's blocking the flow of blood in the artery. So they put a catheter in, and there's a little balloon on the end here, and they can expand that and open up the flow to the artery. Oops, sorry. And this is, I'm sorry, this is kind of blocking, but they can also then put a stent in, and that will keep the vessel open. Okay, so that's a balloon angioplasty, or sometimes we just commonly refer to it as angioplasty. Okay, next suffix is tomy. Okay, so don't get this one mixed up with ectomy. So tomy, a word using tomy would be something like a nephrolithotomy. Yeah, it's a mouthful too. What does that mean? Well, a nephrolithotomy is an incision of the kidney to remove a kidney stone. Okay, so tomy means incision or cutting into. So nephro means kidney, litho means a stone or a calculus or a calcification, and tomy means an incision. So a nephrolithotomy is an incision into the kidney to remove a kidney stone. We do phlebotomy. Okay, so phlebotomy is an incision into a vein. Phlebo means vein, and we do this for the purpose of removing blood. Okay, so that's the same meaning as venipuncture, right? Phlebotomy. So sometimes students get mixed up between the suffix tomy versus stomy. Okay, so tomy is that incision, and it's usually a temporary incision where they're going in to, just remove something or drain something, whereas stomy usually refers to a permanent or semi-permanent opening, right? So they're still making that incision, but then they're leaving something in place, say as a drain or a bag. So, for example, a colostomy, which you may have heard of, is an incision to remove a portion of the colon, usually because of cancer or maybe some inflammatory bowel disease. And this results in a permanent or semi-permanent opening known as a stoma from the colon to the outside of the body. Okay, so they remove part of the colon, and then because it may not, depending on how much they've had to remove and where the surgery has occurred, they may not be able to hook the bowel back up to the rectum, in which case they have to have an opening to the outside for waste products to exit, and it goes into a colostomy bag. Another term that you should be familiar with is anastomosis. So an anastomosis is a connection formed when two tube-like structures, such as the intestines or sometimes blood vessels, are then surgically connected within the body. So here's an example of a patient that had, say, a tumor in the transverse colon. And so they've removed the cancer, and then they will join up the two ends of the bowel together. Okay, and this, where it's joined, is known as an anastomosis. Okay, so this is ideal, right? Because in this patient, they probably don't need to have a colostomy, right? But sometimes they can't join up depending on how much they've had to remove and the location. They may not be able to join this up, in which case they just have to make an opening to the outside. Another example of a stomy that we sometimes come across is in patients that have a gastrostomy. Okay, so this is where they again have had some surgery on their stomach to create this stoma, which is this opening here to the outside, and we can hook up a feeding tube to the stoma to infuse fluids. So this is often done in patients that can't eat normally by mouth for various reasons. They may have had surgery on the esophagus, or maybe they just want to give the upper GI tract a bit of a rest, and in which case they want to tube feed the patient. So they create this stoma, which could either be temporary or semi-permanent, and they have this little button that fits in there. So each patient's stoma is a little different, and they have a specific sort of button that fits into the hole to create a nice seal. And then you can syringe feed liquids through the tube, and it'll go directly into the stomach and bypass the mouth and esophagus. So that's a gastrostomy. Okay, so I think that's it. Just a short little review on some of the more common suffixes that you're going to come across. So hopefully you're ready to test your knowledge, and you can go to the Chapter 3 multiple choice review quiz on the Learning Hub. Normally we would have done this in class, right? How we've been doing in the last couple of weeks. But for this week, it'll just be on the Learning Hub. You can print it out and try your luck at it. It won't be for marks. It's again just for your review to make sure that you're on track. So good luck with that. And the next lecture will be on Chapter 4, and you'll be able to access that via the Learning Hub. Good luck. See you soon. Bye now.